So welcome everybody. Good afternoon. Welcome to this week's mini class from the Arava Institute. I'm David Lehrer, the Executive Director of the Arava Institute. This week we will be hearing from Dr. Clive Lipchin about his new research into COVID-19, sampling of COVID-19 in wastewater. The Arava Institute is pleased to be pursuing this research in wastewater testing to help the most vulnerable communities in Israel. We would like to thank the JNF for their partnership and support of Clive's research and his projects. Anybody who would like to submit a question can do so via chat, and we will try and get to as many of those questions as possible by the end of the presentation. I would now like to introduce my friend and colleague, Dr. Clive Lipchin, Director of the Center for Transboundary Water Management. Clive, as you will be able to tell from his very heavy Israeli accent, was born in South Africa and raised in Johannesburg. He immigrated to Israel in 1991, received a master's degree in desert ecology from Bedouin University of the Negev, and in 1996, he left Israel to pursue a PhD in resource ecology management at the University of Michigan. The focus of Clive's doctorate was public perceptions and attitudes towards water scarcity in Israel. Clive joined the faculty of the Arava Institute in 2003, where he teaches a multidisciplinary course on water management in the Middle East. Clive is the director of the Arava Institute Center for Transboundary Water Management, where he oversees research projects, workshops, and conferences that focus on transboundary water and environmental problems facing Israel, Jordan, and Palestine. His specialty is water resource management and policy. Clive, I want to welcome you to start your mini course.
Thanks, David, for that kind introduction, and thanks to everybody that's come online for this session today. So as David mentioned, what we're working on currently here at the Institute is a really exciting new avenue of research linked to water and wastewater management, and that is using a monitoring of wastewater as a means to better understand the spread and management of the COVID-19 pandemic. So I'm going to share my screen. Let me make sure I can do this. Yes, here we are. And pull up my presentation. Okay. Okay, so title of the talk is Evidence-Based Wastewater Monitoring and Policy for Addressing the COVID-19 Pandemic in Underserviced Communities in Israel and the Palestinian territories. To get us started, this is maybe not the best news for us, but you can see from this table, which comes from Johns Hopkins University, that Israel is #1 in the number of new cases per day, more so than the United States. But you can see there is in position number 4. The reason for this, there are many reasons. One of it, of course, is we're doing a lot of testing. About these days, about 50,000 coronavirus tests are being conducted by the health ministry in Israel today. But of course, this is quite a problematic issue with respect to the number of positive cases coming out of those testings. And of course, I think as everybody knows, Israel is now in the second nationwide lockdown to try to bring these numbers of high infection rates down to somewhat. We are averaging now about 10 to 12% positives per day out of the 50,000 or so tests that are being conducted. Now, that actually is not the full story, because the people that are being tested are people that are going and looking to be tested, and many of these people are seeking out to be tested because they're showing signs of symptoms of the disease. The real challenge here is not only to identify and test people that are symptomatic for the disease, but of course to also try to understand those that are asymptomatic. And that's the biggest problem, because you can be infected with the virus, show no symptoms, but of course you are then potentially going to infect others. This is one of the biggest problems with opening the schools. Kids get infected, they don't show that they're sick, they don't get tested, and then of course they go out and they spread the disease to their parents, family members, and of course, most problematically, the older population, which is at high risk. So we want to figure out a way here of how to get a more comprehensive understanding of the spread of the disease and the spread of infection, specifically to preempt a crisis such as what's happening now. And of course, the great concern now is how close we are to overwhelming the hospitals here in Israel with seriously ill coronavirus patients. So this is just putting the whole situation currently in context for us. Okay. So what are we talking about here? We're talking about what is being termed wastewater epidemiology. This is a new term that's coming out now through a lot of research being conducted around the world on using wastewater as an indicator for the virus. Now, of course, one of the challenges that we face around the world is how do we control the virus from the health aspect, of course, but also there's a very clear economic impact, and there's this really, really problematic tension between, how do we protect people's health, but without causing a complete breakdown and collapse of the economy. And of course, that is the major problem when we go into lockdown. So how can we better manage, or how can we try to balance these two really, really challenging aspects? So the second point there is that there is a clear need to identify a sustainable tracking model that will enable us to reopen the economy while continuously monitoring for the outbreak of the virus. And this is where wastewater epidemiology comes into the picture, because wastewater epidemiology can help us identify outbreaks of the virus through conducting regular sewage sampling in key points along the municipal sewer network. Now, what is really happening now? If you are infected with a virus, but you are showing no symptoms, you are therefore not going to go get tested. You therefore are not counted in the overall numbers of figures, but you are constantly shedding the virus into the sewer when you, of course, go to the toilet. So whether you are sick or not sick, you shed the virus through your urine and through your feces. Now, we can pick up those viruses in the sewer network, and then we can track along the sewer network where are the potential hotspots in the community, when we can map out the spread of the virus according to where we're testing along the network. So where we have communities connect to sewer networks, we can actually determine quite accurately where the hotspots are in a particular area. And this allows us to not move into what Israel is currently doing, which is a nationwide lockdown, but to be much more targeted in terms of who should you be locking down and who should you allow to move more freely. So we can map out the spread of the virus according to where it's appearing in the network. And then we can do some GIS mapping to give more direct and pertinent information to health officials to figure out where the next virus outbreak is about to occur. Now, what you see here is why this is so useful. This is data from a study that was done in the United States by mostly researchers from Yale University. And what you see here in the red line versus the black line is that we can track at least a week before where the virus is before it actually gets out into the real world, and we were testing via direct testing via the health ministry. So what you see here is that we can get results, of the quite accurate of the potential spread of the virus 1 week before we're actually seeing it in the population. So this is a very reliable tool, therefore, to pre-screen where the virus is going to hit next, and then to target more accurately that specific population where the outbreak is going to occur. So this gives us time to prepare appropriately, and that's one of the biggest problems, right? Is that do we have enough time to prepare adequately to control the spread of infection? And so wastewater epidemiology is one of the tools that we can put into place that allows us to do this. So what are we talking about here? We're talking about a concept that's called stream tracing. Why do we say stream tracing? Because we're tracing the virus along the wastewater stream. And this actually was pioneered in Israel back in 2013 when there was a polio outbreak in Israel in the southern region. The polio virus was identified in sewage. Actually, it was identified in the Bedouin Negev town of Rahat. And very quickly, Israel was able to isolate the population, the Bedouin population where the virus was found, and very quickly put into place a vaccination program. So in this case with polio, there was not one case of actual infection. Now, of course, the difference between polio and COVID-19 is we have a vaccine for polio. We don't yet have a vaccine for COVID-19. but a lot of the original work on wastewater epidemiology came out of this polio outbreak that impacted Israel a few years ago. So what we're currently doing is we're taking raw sewage data, we're collecting that data that can represent specific districts along the sewer network, and then we can cross-link that data with the number of infected people from each location, and this enables us to derive and provide quantitative surveillance tools. In particular, this will provide important means to do the following. We want to estimate the extent of outbreaks and their spatial distribution based primarily on the measurements that we're taking in the sewer grids, and to use this as a development of an early warning system that can quantitatively and effectively help us to identify and move towards, hopefully, disease elimination. In addition, a virus concentration method has been developed for the COVID-19 virus in sewage that can relate to the local population, and we can map this according to specific geographic information. And so this is providing us with a proof of concept for how we can use sewage to assist better virus management and develop this into a reliable epidemiological tool. So this is where we're moving towards implementing this type of approach. Now, what is challenging is everything that I've just said to you up until now is research that has been done or projects that have been done on communities that are serviced by sewer grids. Most of the research in wastewater epidemiology around the world is focusing on serviced communities. But what about off-grid communities? Most of the world is actually off-grid. As you see here in this slide, about 1.3 billion people around the world have limited access to water, sanitation, and electricity. Many of these people live in rural and semi-rural communities. And until we focus on these communities, the ability to improve their quality of life is going to be severely impacted. These are also the communities that are probably at the greatest risk to infection of COVID-19 and other viruses or pathogens because of their challenges faced with sanitation, access to government services, and so forth. So in our wastewater epidemiology study, we're not only looking at servicing the sewered communities, but how can we also provide this approach to the non-sewered communities? Now, in our part of the world, around 70% of the Palestinian population in the West Bank is considered off-grid or non-sewered. In Jordan, it's roughly 30%, and in Israel, around 50% of the Bedouin population in the Negev is also off the grid. So these are the communities that are most at risk and the communities that we are targeting in our research. Specifically, the place in which we're working on at the moment is in the Negev region and in the southern West Bank. As you can see here, bordered in this map, which is the watershed of the Hebron, Beersheba, Basor watershed. And what you see here in this map is the complexity of non-sewered or off-grid versus sewered with respect to Palestinian communities, Bedouin communities, and Jewish Israeli communities. So what you see here, for example, everything that is colored in purple are Palestinian communities that are not connected to sewer grids or may have sewer grids, but are not being able to discharge their sewer into wastewater treatment facilities. And the most significant is the city of Hebron and the surrounding communities, which is nearly close to 1 million people. In the case of when we cross from the southern West Bank into the Negev, into Israel, we see a challenge here with respect to the Bedouin population. You can see there the yellow and the orange. The yellow are Bedouin towns that are serviced, and the orange are Bedouin communities that are not serviced by a sewer grid. So there's a mix of on-sewer and off-sewer in Israel, and most of the Palestinian population in the southern West Bank contained within the watershed of the Hebron, Besor, Beersheba system is off the grid. So we're targeting our study in this specific area of Israel and the southern West Bank. This is a slide showing you the sewer grid of the Hebron region. And we are going to be doing some of our wastewater epidemiological studies in the Palestinian region, focusing on Hebron. Now, the good thing is Hebron has a sewer grid. The bad thing is Hebron doesn't have a functioning wastewater treatment facility. You can see here in the green at the bottom, that's where the planned facility is to be built, but it has not yet been built. And plans for a wastewater treatment plant for Hebron have been going on for roughly 10 years with no real progress in sight. So even though there is a grid, the sewage is all eventually being discharged into the environment. Now, what this means is it's creating a cross-border issue of potential conflict between Israelis and Palestinians on the fact that a large proportion of wastewater being generated from the Palestinian regions, from the West Bank, is flowing untreated across the Green Line into Israel. And this is a slide that was actually put together by the civil administration, the Israeli civil administration, which is in charge of Area C of the West Bank, that assessed how much sewage is being generated both from the Palestinian citizen villages in the West Bank and the Israeli settlements. And you can see there, it's quite significant. It's about 69 million cubic meters per year of wastewater being generated from the Palestinian communities, around 21 million cubic meters per year from the settlements. But if you focus on the red, especially on the Palestinian side, you can see that over 80% of the wastewater being generated by the Palestinian communities is not being effectively treated. And this wastewater is being discharged into the environment, either directly into streams or indirectly via porous cesspits. On the Israeli settlement side, you see that here too it's a problem, but it's much less, only about 12%, because the settlements are either being treated, having their wastewater treated on site, or having their wastewater being treated in Israel. This is basically the reality of this. These numbers can be seen in this slide. This is the Hebron stream in the southern West Bank in Area C. This is a running stream of nearly 100% untreated or partially treated wastewater flowing from the upstream regions of Hebron into and eventually across the Green Line into Israel. Now here is one of our real problems from the epidemiological side. These are sheep and goats being watered in this very high polluted stream. Those animals are going to be eaten, and there's a real public health risk in terms of the uptake of viruses and pathogens in this water that is then taken up by these animals. Of course, they're building up a concentration in their fatty tissues, and then of course that is going to be eaten. So there is here a real risk to the exposure of really problematic pathogens and viruses, including, of course, what we're also looking for now is the COVID-19 virus. So this is basically just showing you visually what these numbers are relating to us, or are telling us. So we began to develop our COVID-19 study by focusing on this wastewater stream that is being discharged or channeled via the Hebron stream here. So if you look at my mouse, this is the Hebron River. It originates right at the outskirts of Hebron itself. And from this point all the way to the Green Line, we have basically what you saw in that picture, a continuous, perennially flowing stream of untreated sewage. The sewage continues to flow, crossing the Green Line at this point into Israel. And then what happens here before the river gets to the outskirts of Beersheba, untreated sewage from the Bedouin communities are added to this sewage stream. So what we're trying to do in our study is we're trying to understand where the virus is being discharged along the Hebron stream, both in the West Bank and in Israel. These yellow dots show where we are currently sampling. We're sampling at a number of Bedouin communities, both sewered and non-sewered. We're sampling also directly into the Hebron stream. And hopefully in about another month or so, we will also begin to sample upstream within the West Bank itself. This is basically just showing you what we're doing. We go to the most downstream point of where the sewage is collected. These are some of the people that I'm working with. We have to get in there, take the samples of the sewage, and then we send that wastewater sewage sample to the lab where it gets analyzed for the concentration of COVID-19 in the wastewater sample. This is just a closer look at where specifically we're working. So we're sampling in the following places: in Khura, which is one of the most established Bedouin towns; El Sayed, which is a newly established Bedouin community. In this area here, outlined in yellow, this is the Bedouin village of Batin, where we're doing a lot of our off-grid wastewater work. Now, Batin is one example of a Bedouin community that is not connected to a sewer grid. So they are discharging their sewage into cesspits and directly into the Hebron stream. And we're sampling at 2 points in the stream, as you can see here. To put some of this impact in perspective, Umbatin is a community of around 5,000 to 6,000 people with no sewage grid. In addition, they have no connection to a freshwater grid or to an electricity grid. So they're completely off the grid in terms of water, wastewater, and energy. And we're also sampling further downstream here in another Bedouin town called Tel Sheva, and also sampling the wastewater being generated further upstream from another Bedouin village called Lakia. Okay, this is a summary of the results that we have done so far. We have done a series of grab samples. What I want to show you here is, I'm not going to get into all the numbers, but just to give a sense of what we have, what we have basically been able to show at the moment. So we have here the sampling points. Umbatin 1 and Umbatin 2 is where we are sampling in the environment. Can we identify COVID-19 in the wastewater stream in the river? This is the sampling point for Lakia, Tel Sheva, El Said, and Khura. Now, what we see here, and these are very preliminary results, is that we definitely see concentrations of the virus in Lakia, as you see the numbers here, and in Khura. Now, we expected this. This wasn't a surprise to us because we already know from the Ministry of Health data of people getting tested that these are two hotspots of COVID-19 infection. Now, what we didn't find, as you can see in Umbatin 1, Umbatin 2, we did not find the virus in the wastewater stream in the river. Does it mean the virus is not there? No. It means that we haven't yet developed the appropriate methodology to identify the virus in the wastewater stream. And the challenge that we're facing is the issue of dilution. When the virus enters into the environment, it's much more heavily diluted than in a sewer network, where you basically are being able to sample raw sewage. So one of the things we're working on now is how to develop a sampling protocol where we can overcome the dilution factor. And that's part of the next stage of our work, to try to figure out how to accurately assess what is the concentration of the virus in the environment. And this is really an innovative aspect of our work, because as far as we know, no other research around the world has yet looked specifically at the issue of, can we identify the virus in open sewage channels, which again relates to most of the world's population that is not being serviced by sewer grid. So if we were able to successfully develop the sampling methodology to identify the virus in natural systems, this will be massively useful around the world, not only in our part of the Middle East. So to summarize, this is my final slide. Where we are today, we have begun wastewater sampling in the Bedouin communities. We took our first grab samples. A grab sample is simply going out directly and taking a sample from the sewer and then sending that sample to the lab. An exciting aspect of our work is we're partnering with an Israeli company called Candu. Candu is a company that has developed an automatic sampler. And this is really important because automatic sampling means that you don't only sample at one point in time, which is a grab sample, but you can sample over a 24-hour period, which gives you a greater level of resolution on how much, what's the concentration of the virus in the community. So we have an agreement with Candu that they will be providing 3 of their automatic samplers, and we will install these samplers in the testing sites in Khura and Lakia, and also at the metering checkpoint, which will be able to capture continuously whether or not we find the virus coming out of the wastewater stream from the West Bank, because the metering checkpoint is the point where the Hebron stream crosses from the West Bank into Israel. We will also directly sample for the virus in the Hebron stream in the West Bank. And we'll begin soon sampling in the Hebron stream and also in the city of Hebron. And finally, just an acknowledgement of our funders. David already mentioned that we're working with the JNF that is providing us resources to do our work in Israel. In addition to JNF USA, we're also very grateful for the support of USAID, which is also contributing resources to our work on the Israeli side. And we recently also received support from the Dutch embassy, which is allowing us to do our sampling in the West Bank. So that's my presentation. David, I think I was pretty much on time.
I'm very impressed, Clive. I didn't even have to kick you under the table once. I'm really impressed.
So thanks. I hope that was clear, and I'm more than happy to take questions and comments. And if something wasn't clear, I'm happy to go over some of the points that I made in the presentation. So I'll give it back to you, David.
Thank you, Clive. Thank you very much. We do have a few questions. First of all, a question from Steve Sanderson asking whether or not you are in communication with any universities in the United States on this research.
Well, actually, before I answer that question, I do need to say, and this is a remiss on my part, a very, very important part of our partnership here is Ben-Gurion University of the Negev. So all of our sampling analysis and lab work is being done at Ben-Gurion University. Ben-Gurion is one of the only labs in Israel that has the authority from the Ministry of Health to test for COVID-19 wastewater, so I need to acknowledge them. And we're also working with the University of Haifa on developing some of the public health analysis of this work. In terms of partnerships in the United States, we haven't yet developed specific partnerships on this project, but we do have a really interesting study on wastewater reuse in agriculture with the University of Maryland School of Public Health. We are part of a very large study that's being sponsored by the USDA on that work. We also have some collaboration with the University of Arizona as well. So, you know, we're always looking for opportunities to partner in the United States. So those are just two examples of universities we're doing related work in terms of wastewater.
Great. Am I being heard, Clive? Do you hear me?
Yeah, I hear you.
Okay,
I hear you.
just to make sure my internet was acting funky. Another question is, there is work being done in Arizona, sounding like similar kind of work in wastewater epidemiology, tracking outbreaks at the university campuses and Native American communities. Do you have any knowledge on those attempts at identifying?
Yeah, I mean, look, this wastewater epidemiology, as we're terming it, is being done, you know, all over the world now. So I'm actually familiar with the example that's being done in the University of Arizona campus. We are very interested in actually exploring opportunities with the Navajo population, because the Navajo reality and the Bedouin reality are not too different in terms of their lack of access to water and wastewater infrastructure. So a lot of what we are going to learn and achieve from our work in Israel and also on the West Bank side can certainly be transferred and shared with trying to assist similar types of issues that the Navajo are facing. One statistic that's troubling is in the case of the United States, the Native American population is one of the at highest risk of COVID-19 infection compared to the general population in the United States.
Yeah. Another question is whether what are the Bedouin communities that you're working with? How do they relate to this research? Are they in favor of it? Do they support this kind of attempts to get a better handle on the virus in the community, or is there resistance?
So that's a very good question as well. A big part of our work, which will come after we do our sampling, is public policy outreach. It's very important to be able to communicate the results to the community and also to local authorities. That's essential. So the community has to be a partner in everything that we do. There are challenges. There is a certain level of stigma in the Bedouin community to people that are tested positive. There's also a large amount of underreporting. People that are getting symptoms do not want to go get tested. And so the government is struggling to get an accurate picture of what's really happening in the Bedouin community in terms of the infection. So our work can be very, very helpful. It's non-intrusive. We are not actually testing people, we're testing sewage. So this is something that is, I think, will help to allay a lot of the potential fears or level of mistrust that the Bedouin have. One of the problems is that there is a level of mistrust with respect to the Bedouin community and the government. So our work here, I think, can be very helpful to try to close some of those gaps.
Great. Thank you, Clive. Are there any other questions? No question. I don't see any questions in the chat. So I really just want to thank Clive for this very interesting presentation. If anybody does have any questions afterwards and would like to reach out to Clive, you could do so through our Friends of the Arava Institute. I also want to thank the Friends of the Arava Institute for organizing these mini classes. I believe we have one more mini class in this series next week with Dr. Suleiman Halassa and Rina, who both are the co-heads of the Jordan-Israel Center for Community Environment and Research, a attempt by the Arava Institute working with our Jordanian partners to build bridges between communities cross-border. They will be speaking next week. I think there's going to be a message in the chat to give the time and date for that. Other than that, I want to thank everybody for joining us this evening. Again, thanking our supporters, the Friends of the Arava Institute, the Jewish National Fund, USAID, and the Dutch Embassy for the work that Clive is doing, and in general, all of you for the support you give the Arava Institute and our friends. Thank you very much, and see you next time.
Thanks, everybody.